By now you must be at the comfort of your home. Proper home care is an important part of your recovery and healing, so I would like to take a few minutes to review the instructions that we provided you at our office. In your kit bag, you will find everything you will need for your home care. These include your post-operative instruction sheet, reusable ice packs, gauze, your prescriptions, diet suggestions and recipes, a reminder card about oral rinsing, and a CD with a selection of great and relaxing music. Your healing and recovery is largely dependent on how well you follow these instructions. The enclosed instruction sheet contains all of the relevant information about your home care. On the first page, you'll find the highlights and the key instructions. Below it is a list of items that you should not be concerned about, and then a list of items that you should watch out for and call us immediately if noted. The instructions are described in more detail in the following pages. Let's take a closer look. To control bleeding, simply roll up a gauze and place it over the surgical site and bite on it with firm pressure. You can replace the gauze every 30 to 45 minutes until the bleeding completely stops. Avoid forceful spitting as it can cause disruption of the blood clot. Also, don't use a straw for the first 24 hours and avoid any strenuous activities for 48 hours. Also, do not rinse or brush until tomorrow. On the day following the surgery, begin oral rinses with water or salt water every 2 hours and then continue for at least 10 to 14 days. This is one of the most important instructions for prevention of infection. Make sure to rinse gently for the first 24 to 48 hours and then do it more vigorously on the days to follow. To minimize swelling, place the ice bag on the face for 20 minutes on and 10 minutes off for at least 24 hours. Any swelling will maximize in 36 to 48 hours, and then it gradually diminishes over the next 5 to 7 days. And it usually completely resolves in 10 to 14 days. Do not smoke for at least 7 to 10 days to prevent the many complications that's related to smoking. In the first 72 hours, smoking can cause bleeding problems, and thereafter it can cause complications such as dry socket, infections, and poor healing. Keep your diet limited to soft or liquid for about 3 to 5 days, and then advance as you feel more comfortable. Foods like soups, mashed potato, yogurt, and soft rice are ideal during this period. Look for some suggestions and recipes in your instruction sheet. You may have been given medications in our office or prescriptions to be filled at your pharmacy. You must take your antibiotics until finished and your pain medication for several days as needed. If pain is not significant, you can always taper to Advil or Tylenol. The dosage and frequency of the medications are right on the bottles. Postoperative nausea or vomiting can be due to either effects of anesthesia or the pain medication. 1 ounce of carbonated water every hour for 4 to 5 hours will usually terminate the nausea. Coca-Cola syrup may also be taken 2 tablespoons every 4 to 6 hours. Follow this with a mild tea or a clear soup. If nausea persists, antihistamines or a composite suppository may be helpful. Call our office for more information. If you experience any of the following, please call us immediately. Any increase in pain 3 to 5 days after the surgery, or swelling that seems to increase 3 to 5 days following surgery with pain or drainage, any significant bleeding that continues more than 8 hours after the procedure, any drainage or infection which is marked by swelling and also increase in pain, any rashes, hives, or itching that may indicate an allergy, or a significant opening of the incision area right over the grafted regions. Remember, the most important instructions following your surgery are: number 1, frequent rinsing with salt water or water for at least 10 to 14 days. Number 2, gentle diet to avoid disturbance of the surgical site. Number 3, taking your medications as instructed. If you have any questions, please call us at 301-654-7070. Should you need to reach us after hours or on weekends, please call our main number and then dial 2 when instructed and leave your name and number. I will personally call you back within a few minutes. For additional information on postoperative care, please check out our website, facialart.com, under your guide. Thank you, and we wish you a rapid and a smooth recovery.